And now, give me 1 second because on Facebook I have to enter first. Okay, if there will probably be a message for you for both of them, so Facebook Live and the recording of the session. So I'll ask you please to accept it. And now we can start. So finally, welcome everyone. Welcome to our first webinar. We are the team of the project Health for the Community. Our project started very recently, although we did apply for it quite a long time ago. And our presentation, in this case, this webinar is going to be divided in 2 sections. The first of them is going to be led by MD Russell, me, and Cecilia. Russell is going to present the team, and me and Cecilia are going to present the project itself. And in the second part of the webinar, Dr. Farsana, is going to present the topic of preventive medicine. And in the end, as I said previously, we are going to have an open space for discussion, comments, questions, whatever you want. So, Russell?
Thank you, Sophia. Good evening, everyone, the team and all the participants. Special thanks. I'd like to give special thanks to Dr. Cristiano, Monica, and Sarah Caldes, and all other participants who joined this evening to this lovely webinar. So I'd like to introduce the team of Health for the Community under Healthy Neighborhood Project. So Dr. Farsana, we have here Dr. Farsana, a medical doctor. She's from Bangladesh. We have Normando Viena, PhD in cognitive psychology. He's from Brazil. We have a nurse, Israt Jahan. She's from also Bangladesh. And it's me, MD Russell Ahmed. I'm the manager and also a community mediator, also from Bangladesh. We have Sofia, the project coordinator. She's from Portugal, and she's a teacher of our organization. We have here Cecilia Menduni Luis, PhD student and investigator in anthropology. She's also from Portugal and originally from also India.
Thank you, Russell. Okay, so now we are going to present the project itself. First of all, what brought us here? It was simple. We had the opportunity of helping people in the community, and we took it. I couldn't put it in a simpler way. The program Healthy Neighborhoods has been around for quite some time, at least from my knowledge, and they opened a financing proposal, a financing program in November of 2019. So many groups many teams of different associations could propose a project to them, and they would evaluate it and see if it was fit to be financed by them. Fortunately, we proposed our project and it was approved. It was financed by them, so they are our financer. And also, to be able to be financed by them, we had the great opportunity to have a partnership with CAS Central Lisbon pilot project for social prescription of Lisbon. In this case, actually, fortunately, we have here today Dr. Cristiano, who basically is the face of our partnership with them. So this is a very good thing. And our project, basically what we aim in our project is the health and well-being of immigrant communities. And our project had one very simple idea. It was to try to show everyone the importance of basic access to health. That was basically it. So in this case, we follow three baselines in this project. One of them is health, obviously. The second one, as mentioned previously, is social prescription. And the third one is the environmental factors of it all. And now the next two slides are Cecilia, so go ahead. Cecilia, you are muted.
Well, the basic idea of this project begin with the contact with all the immigrants, and it was something that was made by PMA just to ensure that all the immigrants have not all the problems solved, but someone with who to speak about them. And the creation of the community health workers for we are going to do it, and we are working on it now. It will be for the mediation in their own language in different communities. So we intend to have participants from different communities here who can represent the situations inside communities. So it can be something that we can do together and create a network. We are going to work in the geographical areas of Arroio, Santa Maria Maior, and São Vicente. This project, we have a target audience. There are the children, young people, the working adults, women, and elderly people also.
Thank you. So in this case, in this project, we want to develop a few things. In this case, we want to develop with the members of the communities better health conditions based on the preventive medicine practices, healthy habits in general, and assuring physical and psychosocial well-being of groups that present vulnerability factors, and language barriers. We are actually going to focus highly on the physical and psychosocial well-being of groups in further webinars, specifically with Dr. Farsana and Dr. Normando. Okay, let me just skip this. And we have 4 sub-projects in our main project is called Health for the Community. We have 4 sub-projects, and the 4 of them are Project Together for Health, where we, in this one, we are basically going to mainly talk about, as we said previously, the insurance of the well-being of the community, and that's the main point of preventive medicine. That's why we are doing this first webinar in preventive medicine. The second is Project COVID-19, which we were first going to use mainly to show everyone guidelines like COVID-19 guidelines by the government and vaccination guidelines and many things that we could use so we could help people better understand the virus. Although now the virus has been here for, as we all know, unfortunately, over a year. So we are basically in this topic of COVID-19, we are probably just going to mainly use it to inform people about how to get vaccinated, because vaccination is still a very important factor in this situation, but especially the psychosocial effects on the community that COVID-19 and the whole pandemic had. That's going to be our main goal with this project of COVID-19 right now. Then we have Project XX, Women, Children, and the Elderly in the Community, where we are going to try to develop better food and hygiene habits and physical exercise in this specific group in the community, so that women, children, and the elderly. And finally, our last project is Project 4R, Environment, Reduce, Reuse, Recycle, and Rethink. Mainly about recycling and waste disposal and all of that, all of those kinds of things. And now, Cecilia, go ahead. You are muted again.
we intend to have the mediation between immigrants, patients, and the health centers, the disclosure of the information about access to health service in normal situation and in context of the pandemic, and also the prevention of counseling in case of confinement, infection, and to who had COVID previously also. We also intend to have this referral for mental health follow-up with identification of elderly people in isolation and toward the good practice related to health and hygiene. And today we are going to have our webinar about preventive medicine.
Thank you. And finally, just to close up our part, what we can and what we hope to accomplish in this project, we hope to ensure better health management in the immigrant community. We hope to share as much COVID-19 vaccination guidelines to advise everyone to get vaccinated as possible. Give me 1 second, okay. And we want to also help newcomers better understand the Portuguese health system, COVID-19 prevention, and subsequent vaccination. And with that, the presentation of the project is done. I'm now going to pass to Dr. Farsano, who is going to talk about preventive medicine.
Hello, everyone. First of all, thank you for sparing your Friday evening to attend our webinar. This is Dr. Farsano. I'm a medical doctor from Bangladesh, currently living in Portugal, Lisbon. So I'm a part of this project, and I'll be a part of this project with a target to achieve health for the community. And to achieve that, today, basically, we are focusing on preventive medicine. So let's see what we mean by preventive medicine and what health as a whole means. So please can we pass to the next slide? Thank you. So as we are talking a lot about health, so let's first see what health means as a whole. So WHO defines health as complete physical, mental, and social well-being, and not just mere absence of any disease or infirmity. And what do we mean by that? We mean that it's just not physical fitness that matters to be healthy. It's all the surrounding, all the social, environmental factors, and even the inner peace of mental health matters a lot. It's about 1/3 of all health. So we will try and focus on each aspect with a goal to achieve a healthy community. So we can move to the next slide. Now moving on to preventive medicine. As we all know, there is an old quote that prevention is better than cure, which indeed it is, because it not only reduces the load of disease on an individual, but also the effects of the disease in a community sector or in health sector as well. So preventive medicine would focus on the health of the individual and community with the goal to improve health and well-being, preventing disease, disability that the disease causes, and finally preventing death, according to the American Board of Medical Specialty. So we can move on. Here we are to see the goal of preventive medicine. The goal of preventive medicine, as we already spoke in the previous slide, and this is just to increase our focus on it, that it is to promote health, such as by creating self-awareness, creating a sense of leading a healthy life, and just being a total well-being of a person by preventing disease, disability, and death. And to achieve this goal, who can practice preventive medicine? As we can see, there are 5 hands joining together to reach the goal of the preventive medicine. Each hand indicates each sector of people. It's not only the healthcare workers that should work on preventive medicine for the betterment of community. Indeed, it is everyone who lives in the community. It is the public themselves, the healthcare workers, the doctors, the nurses, any health care worker can work towards preventive medicine. So it is achievable by all. Just to create a sense of responsibility among oneself, which empowers one for their own health. So this is what we will try to achieve, because this will also lead to frequent or substantiality of the project itself. It will be self-running for several years, which can be passed from decade to decade, or generation to generation, a sense of responsibility towards self-health. So, yeah. Now, how we are going to involve preventive medicine with our project, the Healthy Neighborhood or Health for the Community. We can take preventive measures at different levels to maintain health, leading healthy neighborhood for the dwellers of the community to lead a healthy lifestyle. We will also focus on the social determinants of health, where social prescription would play an important role, as it has been running in the community for long. Many healthcare professionals, especially Dr. Cristiano, has been devoting a lot of time and dedication towards creating awareness among this. And we'll also try to give a responsible helping hand to take this further. And we'll also, it's not only confined to the condition of the people they live, but also their social positioning, their housing condition, and at times the occupational risks they are exposed to. So please, the next slide. Okay, so as we were talking about at different levels in which the preventive medicine can be applied to, with the overall goal, we can see the icon of a man pushing away the hospitalizations, the number of disability or disease caused, and finally, death. So coming towards the left side of our slide, as we can see, the levels at which preventive medicine can be applied to. We can see the titles as in the orange arrows, we can see that a preventive medicine firstly can be applied before a person gets ill or suffers from any disease. And we can also apply preventive medicine after a person gets the disease or after a person gets ill. So moving to the first one, the former one that we spoke about, when a person is not sick, what can we do to prevent him from getting sick? We can do it in two sectors, a primordial sector, where we can look around the environmental, economic, and behavioral inhibition of disease-causing factors. So, as we know, the environmental factor is a part of our project, which we'll see in the later stage. If we maintain that, it could prevent disease. The economic factor, and we know the social part is almost 1/3 of the health, as we have seen previously. And the behavioral part, which also involves the mental aspects, as we will also deal with the psychosocial part, in which Dr. Normanda will immensely help us. Now coming to the next one, before the disease occurs, we can primarily prevent the disease. Now, this is a very important sector in today's pandemic, which we are not yet over with. So what can we do for primary prevention? For example, if we talk about COVID, so we can primarily prevent by simple measures such as maintaining hygiene, wearing a face mask, maintaining distance. So these are the ways in which we can, preventing gatherings, a simple measure that can prevent the occurrence of disease itself. And moving to the next one, the secondary prevention. So how can we prevent secondarily a disease? Suppose there are some signs of or symptoms of disease, we can increase the access. Here's where we'll play a mediating role. When a patient is having a minor symptom, we can increase the access to health so that they can be diagnosed early and prevent the complication of disease. Moving on to the next one is the tertiary prevention. A person has got an illness, We have diagnosed him early, but still certain illness can lead to complication. Our target there would be to prevent such complications, as we have been talking about, as Sophia mentioned, that we would be focusing on exercises, physical therapy, physiotherapy. This how to decrease the complication or prevent the complication of the disease itself. So thus to reduce the disability. In this way, we can together work towards a healthier person, in a healthier family, in a healthier community. So the next one. Now, how are we going to utilize preventive medicine, which is a huge topic, into our project? We are still in the thinking process, but we have got certain thought clouds that are working in our heads, which will be discussed in our future webinars as well, is to create health awareness among the community, preventing COVID and preventing post-COVID complications, working on maternal health by creating awareness in the importance of preconception care, working with parents and children to ensure building up health knowledge and healthy habits, prevention of chronic illness such as diabetes, high blood pressure by creating awareness, and finally, not forgetting the elderly members of our community by involving them. We would go for elderly inclusion. Thank you so much for listening to me so patiently. And these are the things that we are thinking to work with all of your support. Hopefully, we'll bring out something that could be useful to our community. Thank you.
Okay, thank you everyone so much for listening. Right now on your screen you have our information, so PMA's address, our website, and our contacts, so our emails and our phone numbers if you want to reach out to us for to talk about the project. So I'm going to leave leave this on the screen for a couple of minutes, but we are now going to open the space for discussion. So we're going to open the space for questions or comments that you want to do about the project. I just ask you, please, if you don't mind, to use the raise hand option in the reactions sector of your tab, so we can be better organized with this. I'm going to now stop sharing. And if anyone wants to, we can send you in the chat the information. Okay, yes, perfect. Thank you, Celia. So we now have an open space for comments, questions. Feel free to participate. Oh yes, exactly. If you have any difficulty in turning on your mic for whatever reason because of the place you are, you can also ask your questions through our chat. Thank you, Carol. Thank you very much. I honestly don't know if I welcomed you all, if I thanked you all for coming. If I didn't, I'm sorry. At the beginning of our webinar, I do thank you all for joining us. It's very important to have so many people interested in our project and so many people joining in our first webinar. So thank you so much. Okay, I'm just going to maybe. Oh, sorry, Norman.
Oh, sorry, Sophia.
Go ahead. Go ahead.
Okay, I would like to do a question. First of all, I would like to say good evening to everybody and congratulations to the speakers for the great presentation. And I'd like to do a question just to all of us thinking, well, how could be the contribution, how the partners can contribute with this project. All partners like Junta da Freguesia, health service, education service, universities. How can you think and see these partners as organizations that could improve this project? Because this project is not just a responsibility of us, of this group, this step, but this all of us. What do you think? Just to think and reflect about that.
I'm not Schwarzana, do you want to answer this one?
Yes, thank you, Normando, for the question. It's a very important thing to involve the partners, and their involvement is immensely important, and that's the reason we have them here. As we talk about our project, with our, we mean the whole community as a whole. It's not the few members that are present here. It's for the whole community of the immigrants that are living in Lisbon. So in that case, we mean it's ours. So we all need to work together to reach the goal for healthy community for all. And regarding the involvement of the partners, as we have number of sub-projects at different sector, we highly need their involvement, because without their advice, without their support, it will be highly difficult for us to, get through every point. We need their kind advice and kind support in whatever we are doing, in every step of ours. Thank you. I hope that answers the question.
Okay. Monica, I see you have your hand raised. Let us just answer the question of Dr. Christian first. He asked the question on chat. Thank you. I don't know, maybe Cecilia would like to answer Dr. Christian's question. So Dr. Cristiano asked, how are you planning to reach an audience, to recruit new participants from the community? There is a big potential in these meetings. You are muted, by the way.
I'm not. Well, we intend to go step by step, and we need to walk through the city and to search the different communities and to try to find some people who can represent it. And so we will have a good group. I cannot say it's a big group, because I don't know how many people do we have in the end of this project. I hope that we can have participation from different communities and geographical areas also, but it's something that I'm doing like Sophie and like the others, but me, because I'm an anthropologist, so I work with a lot of communities in Lisbon and the city of Lisbon and outside Lisbon, but downtown I know a lot of groups, so I intend to bring all those people, and I hope that when the project grows, we will have the message spread all around, because as you know, Dr. Cristiano, in these communities you have something that is very normal, it's just people speak with each other, so the word goes through the city. So we will have more people, because we know there's a network, they have networks are connections, and the connections can be to the project. Also, accordingly to the social prescription, we will have more people, because as I know, as investigator of undocumented people, there are a lot of people with problems themselves. So there's also a way for them to know that someone can help them to do something and to take care about their situations. We cannot solve everything because we are small, but we will try. I don't know if I've answered you.
We can also say that in the first days, I think, of our project, the project was already greenlit, but we hadn't started it officially yet, and the team joined, and they just went. I was putting that day because I was busy with a couple personal things, but a few members of the team joined, and they just went like through the whole street, just putting posters on shops in the street. And in that day, like the access to our website, the people asking for appointments and for volunteering just got sky high that day. So it was absolutely amazing. It was just one day doing that would do in our project. Yes, we also agree. Yes, it is very important to invest in also social media targeting in our audience. Yes, we agree, Dr. Cristiano. Thank you so much for your question intervention. Maybe we can all move on. Monica, you had a question? You are
sorry.
okay.
Sorry. Yes, sorry. No, it's not a question. Just to say congratulations for your project. Russell has been already talked a little bit about it, so I already had some information. Just two contributions. One of them is that, and I think part of you know that, as the Aga Foundation have done some health materials about several issues that are translated in some language like Hindi, Urdu, Nepali, and they are available not in paper anymore. We finished the paper form, but we have it in PDF, and it's possible to print them again. So I have already done some examples to Russell, but if you think maybe they are useful, I can send you by email, and you see if it's a good material. It's about the health system, and some of them are in the health system in your website of the health ministry, but other ones are about pregnancy and things like that. So maybe they are useful to be printed and to give to person in the health context. This is one of the contributions. The other one is that a little bit upstairs in Damasceno Monteiro, so up in Arroios, we are working with a large group of women about sewing and creative in industries, and we have several training courses. So maybe it's a place in time, not now in December, but in January, February, that we could speak and do some of your work with that women over there and pass the information. Okay.
It's certainly something that we can think about and discuss. Thank you so much. Thank you so much.
Welcome.
Does anyone else have any questions, comments? I remind you, for the Portuguese people, you can also do them in Portuguese. It's absolutely fine. And you can also do them in the chat. So we're going to wait a little bit to see if there's any other questions or comments or whatever it is. Okay. In this case, I believe the silence says it all. So there's no more questions or comments. Once again, thank you all very, very much for joining us. We will have more webinars throughout the project. Our project has the duration of 1 year. We'll have more webinars in our project, so you are more than welcome to come to those. You will be invited again as you were to this one, and we hope to see you more in our project. We hope that you enjoyed our webinar also. If you are interested in any way in collaborating or talking to us about our project, not in this webinar setting, please, you are free to do so. We have our contacts in the chat. Cecilia sent them a few minutes ago, all of our contacts. And I hope you have a good evening and a great weekend. Thank you so much.
Thank you so much for joining us.
Thank you.
Bye-bye.
Thank you.
Thank you, Sophia and all.